I'm just going to tell you guys a little bit about my background. So prior to coming to hospice, I was a primary care doctor for 10 years. So what I'm talking about is near and dear to my heart. It's, now my role is a little bit different, but what we're going to talk about is how do you talk to your doctor and how do you both get the most out of your visit with your doctor, when you go in. Because I'm sure you've all noticed that your doctor seems to be running more behind, seems to be seeing more patients, it's harder to get in.
Yeah.
Better?
Yes.
Oh wow, that's different. Okay. Okay, so as we all know, you probably sense that when you go into the doctor's office. Everyone just seems a little bit more rushed, and there's more paperwork every time you go in. And I'm just going to start with kind of explaining why that has happened, so we don't just hate our doctor for being annoying. So what's happened is that most doctors now are employed by someone, whether it be a hospital or a medical system, an insurance company even, and therefore they're sort of set to different standards. They're almost set up to run like a quota system. So your doctor has to see so many patients a day. So in order to see so many patients a day, they sort of have to change their schedule a little bit to make sure they can do that. They're also judged now. So Medicare watches your doctor to make sure they're meeting certain quality measures. So are your patients' diabetes controlled? Are your patients readmitted to the hospital too frequently? So all those things have just sort of changed the way doctors' offices have run. Okay, so thank you for mentioning that quote, Lisa. So the reason that I am so fond of that quote is my husband, it was 2008, had a pretty massive brain surgery and sort of switched our lives completely upside down. So I went from being the doctor to being the caregiver for a very long time. And he is now back to normal and doing pretty well, but I think we saw probably 150 doctors in the last almost 10 years. And I've seen some great ones and I've seen some hideous ones, and I've learned along the way how to make it better for everyone as we go. So we did a lot of dancing in the rain, or at least tried to. So the first thing you want to do when you realize you need to go see your doctor, you want to treat that like you would treat going to the grocery store. When you go to the grocery store, you have a list. You know why you're going to the grocery store, and by God, you're going to make sure you get your list done before you go home. You're also going to be nice to everyone while you're there to get it done, but you're going to get it done. So make sure you know the reason why you're going. So set your goal for your appointment. Are you going because you want a physical? So if you call and you talk to their office and you say, I want a physical, or I want a checkup. So what that means on the other side of the phone is that person thinks, well, this person's going to come in and they're going to talk about, they need their mammogram, they need their colonoscopy, and they need to get their blood pressure checked. So in a doctor's office mind, that's what a physical means. Let's say you're on blood pressure medicine and you tell them, I just want to come in for my blood pressure checkup. So they're going to put you in a very short appointment slot, probably about 10 minutes. You're going to come in, you're going to get your blood pressure checked. Your doctor's going to ask you probably about 5 questions. You're going to refill your medicine. You're going to be on your way. Okay, that may not really be what you wanted to come in for. You might want your blood pressure checked, but you've also got about 6 problems that have brewed up since you saw your doctor the last time. So you need to be really upfront with the person when you schedule the appointment to say, I've really got about 3 problems I need to talk to he or she about. Or you may just say, nope, I just need my checkup. And that gives the person on the other line an idea of how long should your appointment be. Now, some doctors are going to give you a 15-minute appointment no matter what. But if you tell them that you need X, Y, and Z, they may tell you, well, it's best if we split these appointments up. Let's have you come in for your physical. Let's have you come in for, your knee pain, your sore throat, and your stomach ache. Because the doctor wants to make sure your needs are met, and you want to make sure your needs are met. So that's a good way to start, is just make sure when you call, you really know what you want to set up on the phone. And you can even ask the person on the other end of the line, how long is my appointment? And if they tell you 10 minutes, then you can say, I need longer than that. You may or may not get the answer you want, but at least you've kind of made it up front. That's what I think I need when I come in. And then also ask, is there anything I can do beforehand? I'm sure you guys have all been to a new doctor and got a 6-page pile of paperwork. That's probably at a minimum. You're probably getting 12 pages. So try and get that beforehand. That way when you go, it's done. You don't have to sit in the waiting room for another hour and a half trying to fill all that out. If you're coming for your checkup, you might also say, can I go ahead and get an order for my lab work? Because it's always better to get your labs done before your appointment, okay? If you are on cholesterol medicine or diabetes medicine, or your person that you're caring for is on those medicines, if you have those numbers in front of you, your doctor has them, then you can talk about them instead of trying to get the information from their medical assistant or nurse after the fact. So always ask, is there anything I can do before I come? That way we all are on the same page and we can get the most out of our visit. And then also, try not to let things build up. So if you've had foot pain for 6 months and you just keep saying, oh, I'm going to wait till my physical. Oh, I'm going to wait till my physical. Well, then you get to your physical and all of a sudden you've got 8 complaints because your foot hurts, your knee hurts, you've got a sore throat, and you've got a bellyache. It's probably not realistic that all those things can be done in one visit, and then your needs aren't met and you're left annoyed because your doctor didn't take care of everything. So just try to the best of your ability to try and get in when things arise. That way things don't fall through the cracks. And then just like the grocery list, write things down. So if you know you want to talk to your doctor about your knee, your sore throat, and your stomach, write those down. And write them down in order of your priority. Okay, if your knee is your most important thing, your doctor may be running an hour and a half behind that day and having a bad day, and for some reason he can't get to all 3 things on your list. Make sure your knee is the first thing. Okay, and when you're explaining that to your doctor, be completely specific. You know, what happened? Why does it hurt? Where does it hurt? What makes it better? What makes it worse? What have you tried? And then don't ever be embarrassed, because we say this all the time, we've heard it all, but I can tell you some stories, we truly have heard it all. So don't ever be embarrassed. You know, and unfortunately, a lot of the times those embarrassing things are the most important symptoms people have. You know, those things that relate to going to the bathroom and all those very unpleasant things, those are things that really usually point us in the direction of where we need to try and make sure we're diagnosing your symptoms correctly. And then with that list, just make sure you're taking notes. You know, I've even had some patients ask me, do you mind if I record the conversation? I don't mind. You know, some doctors may say absolutely not, but that's an option. You know, if you think you're going to get home and forget, ask to record it. You know, most of our cell phones record things, or you can bring someone with you to record it. And then that kind of goes into the next question of bringing someone with you. So if you've got something that's really concerning to you and you're really worried about it and you're afraid you're not going to hear everything, bring someone with you and make sure it's someone you trust, because you're probably going to have to talk about things that aren't the most pleasant and that you don't really want to talk about in front of someone you don't trust completely with your secrets. And then make sure they're listening with you. So when you ask your friend, ask your sister, ask your neighbor, and tell them, you know, I'm going to talk to the doctor today about my stomach pain and I'm really worried. Would you come with me so that we make sure we get the right information? But then make sure you're talking to your doctor, because a lot of times what I've seen happen is that person talks for you. Sometimes that's good, sometimes that's bad, because then sometimes you're really not getting out what you wanted to say for your visit. So your doctor may ask that person, well, what have you noticed? Like, say we're talking about something really sensitive, like you're worried about your memory. Okay, that's something that doctors don't like to talk about and patients don't like to talk about. So a lot of times that will come in, the friend, or let's say you're an elderly person and your daughter has said, Mom, we're worried about your memory. So the daughter decides to bring you in. The doctor is going to ask the daughter what she's observed, but you also want to make sure that you're expressing your thoughts and your opinions, because the doctor does want to know what you think. We don't like when people talk over our patients. We want them to have a voice. But we also want the caregiver to have a voice too, because obviously people don't realize sometimes when we're talking about memory issues what's going on. Okay? And the other thing I will say, just as a side, is over the years I've had lots of patients bring me probably stacks this thick of all their reading materials or things they found on the internet. Nothing will annoy your doctor more. There are wonderful resources on the internet. WebMD is usually the first place I tell people to start, because it's safe. It's an evidence-based website. You're not going to find anything crazy about some supplement that grew in Zimbabwe. But it's still not your doctor. So read. It's great to be prepared before your appointment, and even tell your doctor, I've looked on this website, I read this article, I looked in the newspaper, I watched Dr. Oz, something else that will tick off your doctor, just to warn you. Most of us don't like Dr. Oz. But tell your doctor that and say, what is your opinion? What do you think? And they may say, I don't know. I've had people tell me about some weed that grew in South America that I don't know about, and I'll look it up for them. But try and kind of summarize what you've learned and what you've researched, instead of bringing your doctor 6 inches of reading material that they probably will not read, which will annoy you and them. So just say, I've read this is what I've learned, what do you think? And hopefully if they don't know, they'll get back to you. So that's just my side note on the lovely internet nowadays. Okay, and then let's talk about, so you're in your visit and you've discussed your needs. You've got this belly pain that you're really concerned about. And your doctor says, okay, we're going to get a CAT scan and I'm going to send you to a stomach specialist. Okay, that sounds good to me. But go the next step and ask why. Okay, why are you sending me to a stomach specialist? Why are you going to get a CAT scan? Why are we going to check this blood work? Because that helps you prepare for what might be next. Okay, your doctor would say, well, I want to make sure you don't have an ulcer. I want to make sure he may even say something like, I want to make sure you don't have colon cancer. And you want to know that, okay? You don't want to just go into things blindly. You want to know what they're thinking and why they're sending you these different places. And then ask, how's that going to happen? Okay, and this has happened to me a million times with my husband over the last almost 10 years. That doctor says, we need you to go get that test. Okay, great. Well, now 2 weeks have gone by. Was I supposed to schedule the test? Were they supposed to schedule the test? Who was supposed to call? Maybe they changed their mind. And that's when it just becomes important to be your own patient advocate. You always want to be nice. It's what I've tried to tell my husband over the years. You call and complain, it's not going to get you anywhere. But just make sure that you know before you leave. Do I need to call, and if so, who do I call? Or are you going to call me? Should I expect a call back? That way nobody's waiting and wondering what was supposed to happen and why didn't it. And then also find out, okay, now how am I going to get my results of this CAT scan? Okay, I know why you want me to do it, and I know how we're going to schedule it, but how am I going to find out what it showed? Some doctors prefer that you come back in so that you can talk in person, particularly if it's something they're really worried about. And then if that's the case, just schedule your appointment now. My CAT scan's going to be on Tuesday. I'm going to see you on Thursday or Friday. Okay? They also may tell you, nope, don't worry, the nurse will call you. And if you're okay with that, that's fine. But it's okay to not be okay with that. You can say, I want you to explain it to me. But it's okay to say, I'd really like it if you call me. And you may get a no, but at least you've tried. You know, if you want your doctor to give you your answer, just try. Okay? And then, you know, after that, then you've got your results, and then you can kind of move on to the next step. But you always want to make sure you kind of close that loop before you ever leave the doctor's office. Know how it's going to happen to get it scheduled, and how are you going to get your results, and then what's next. Because otherwise you're home, and you don't know what to do now, and then 3 or 4 weeks has gone by, and you still haven't gotten your problem resolved. Okay. And then the part about being your own patient advocate. You know, this is something that's sort of changed a lot in the last 15 years of medicine too. Your doctor used to be in charge, okay? Your doctor dictated what tests you had, when you had them, what medicines you took, how you got them, and all those things. And now we look at patient-centered medicine now, okay? Doctors recommend treatments, and doctors advise people what to do, but it's your health. Okay, and with that comes some personal responsibility. We have to make sure that we're going to our doctor and that we're following through with what our doctor recommends. But you also want to make sure that you're kind of pushing your medical provider if you're not getting what you need out of them. But always be nice. So if you call and scream at the receptionist, you can guarantee she's going to go back to that doctor and say, Mrs. So-and-so is a blah, blah, blah. And then you kind of got that X on your chart for the rest of the year. You don't really have an X, but your doctor remembers that. So just be nice. Yes. Please. So what happened, there's two things. So mostly it's so the whole world of medicine has changed to where doctors are now sort of graded and rated on the experience of care, which has happened with hospitals. So if you guys get a test done or you get surgery, you'll notice that you very often get a survey in the mail. So hospitals are rated, nursing homes are rated, soon us hospices will be rated, all based on patient experience. So it's moved more into a realm of making sure that the patient is getting what they need. So this has all been driven by the government primarily, mostly Medicare. There's good and bad to that. Obviously, we want the patient to have a wonderful experience, but it kind of changes the way care has to happen, because now instead of focusing on just talking to you and making sure we're doing the right thing, your doctor is now making sure he checks all the right buttons in his computer to make sure that he's graded right. So it's up and down. Good thought, but it's difficult to really make happen. Yes?
Does patient-centered, does that explain why my mother-in-law's primary care doctor is not getting reports from all the specialists he sends her to? Because I called her assistant. I do my mom's phone calls. She can't hear. And so I called the doctor's office and talked to his assistant, and I was telling her the latest changes from the pulmonologist that he had sent her to, and medications and all. She goes, man, I love talking to you. You have all the details. Most people don't have that. And I'm like, really? Didn't you get this report? No. And so if I'm not telling him, how can he coordinate the care if he's not getting the report?
That's a very good question. So that is not uncommon. This happened to me all the time in private practice too. What's happened is health systems have developed. So if you're a doctor at Barnes and you go see another doctor at Barnes, you can guarantee that pulmonologist from that, if they're both Barnes doctors, they're going to get each other's reports. But say you want to go see a pulmonologist at Mercy. Well, Mercy's probably not going to do a great job of sending him to your primary care doctor who's from Barnes. So that's why this happens, because everything is in electronic medical records now, and if you're not in the electronic medical system, things get missed. So that's why the patient advocate thing becomes important, just like you said. And it's not right. You know, you shouldn't have to do that, but in today's world, we do. And like I said, I learned that first and foremost with my husband and all of his specialists. Your doctor, the way we used to handle this in my office is every time I sent someone to a specialist, I had my nurses keep a log. You know, and if 2 months went by and we didn't get a consult letter back from that specialist, I had them call and get it. Now, you can imagine how much time that took somebody to do, and not all offices have the ability to have one person to just track down, like say I ordered a CAT scan and I never got the result. So is that because the patient didn't do it or because I never got it? And that's all the breakdown with healthcare. So that's this whole thought of if we're all electronic, it's going to be wonderful, but that's not the case because there's 150 different electronic medical records, and not all of them sync together. So you, unfortunately, have to make sure that your doctor is getting those tests. And that's why, like I said, this closed loop is so important. When you say, your doctor says, I'm sending you a pulmonologist, and say, okay, then what? Okay, my pulmonologist is going to change 4 of my medicines. Do you want me to call you back? Do you want me to come back in? And most doctors will know if there's a certain doctor they don't get results from. Like, let's say I really like Dr. J, but Dr. J never sends me a consult report. My nurses know, she's sending him to Dr. J, I better call in a week. So a lot of offices will figure that out, but it's also making sure your loop is closed before you leave the office. So that when you go to check out of your doctor's appointment, those are all questions you need to ask. I'm sorry, I wish that weren't the case, but it just is. Yes.
And I had a doctor come in, evaluate her. I told him the circumstances. The next doctor came in, I had to tell him again. The next doctor came in, I had to tell him again. And then they transferred her up to ICU. The nurse called me at home after I went home and said, we don't have her records. I said, are you kidding me? I said, I talked to 3 doctors, had to reiterate 3 times, and now you're telling me you don't have the records. I said, they went up with her on the gurney upstairs. I said, look, and she went back and looked, and there they were. Now, that's a communication problem within the hospital itself, and I did tell the doctors that.
Yeah, and that happens. And part of the issue is with your teaching hospitals like Barnes, so you probably taught to an intern, and then a resident, and then a fellow, and then the attending. Which, when we are trained in medical school, they train you, don't trust anything that anybody else says. If the resident told you that the patient didn't have chest pain, you better ask yourself, or you don't know the answer. So unfortunately, when you're in a teaching hospital, that is going to happen almost every time. And it's not that they're trying to be a pain in the butt, it's a learning. It is a stressful situation for the patient. It is. I know. I know. And like I said, a lot of these things aren't right. They just are what they are. And I've been through it, I can tell you. My husband spent a lot of time at SLU, and I've been it. And it is. And part of it is there's good intention behind it. They want to make sure that they truly know your mother. But unfortunately, this is what becomes of it. Yes.
I had an incident happen where we seen the neurologist at Barnes, and he wanted to make sure my kids were there. He wanted to make sure he met them, let them know what's coming up, what's going to be happening with them, and all that. Anyway, the beginning of March, he went in Barnes, and he was in there for 3 days. admitted him in the nursing home. So we got an appointment in the nursing home before our days were up, our 21 days for Medicare or something. And so they transported him back to see Dr. Black. And when we went in there, this doctor that didn't give us any good news at all. He didn't even examine my husband. He totally looked at him like he was doomed. He wouldn't even talk to him. And I was like, he goes, no, are you sure I saw him in the hospital? And I was like, well, yeah. You're the one that put him in the nursing home. You're the one that wanted to meet my kids. Here they are. Well, oh, good. Oh, no, you've refreshed my memory.
Yeah.
And then I handed him the stack of papers of progress that the therapist had done in the nursing home. He threw them aside. Oh, we don't need them. So what do you?
Yeah.
I know you said you go through so many doctors.
Yeah.
We never want to go back to him again, and he's his neurologist at Barnes.
So what I would suggest to you, and what I did with my husband, and obviously I'm a little bit of a benefit because I know the medical lingo, but I have almost a 12-page Word document of every test he had done, every doctor he saw, and what they said. Because I don't remember all the doctors he saw. And I can tell you that, some doctors are just jerks. I've met plenty, okay? They just are. They're like the rest of the population. Some are just jerks. But some of them, I can tell you back, like when I worked in the urgent care, I saw 45 patients in 12 hours. Okay, for one, it's absurd, but that's what I had to do to work there, and there was no way I was going to remember who I saw yesterday. So some of it is what doctors are now, like I said, this quota system of medicine that's developed. You see 30 patients a day or you don't work here, and that's unfortunately what a lot of it is. But for your case, you did the right thing. You've got to keep your own notes of what's going on, and then you just cut ties. You just unfortunately start all over. Yeah. 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 I'm sorry. I wish I could tell you that I had an answer for that one, but just some aren't nice. Yeah, you just start over, and I've done that myself too. And then unfortunately, then you're waiting 2.5 months usually to get into somebody, but that's just what you got to do. Yeah. Yeah, and that's why, and the other point I'll make to that is that's why it's so important to have a great relationship with your primary care doctor, because when things like that happen and now you're without your specialist, well, now you've got all these complex meds, who's going to refill them? If you've got a great relationship with your primary care, they can step in for you and say, look, I understand it's going to take you 2 months to get into a new neurologist at Barnes, SLU, wherever. Let me help you for a couple months. So that's why this primary care relationship is so important, and making sure, like I said, you're closing the loops, you're keeping them informed. Yes. Yes.
So then is it my responsibility to make a list of the change of medications and share that with the doctors prior to her
Yes.
next visit? Or is it the doctor's responsibility to share that with other doctors?
Well, and that was another thing I wanted to bring up. So we'll talk about that now. It really has to be your responsibility, okay? So anything that has changed, like we're just going to use your primary care doctor as kind of what we're talking about today. So anytime you go in to see your primary care doctor, you want to bring your medicines, whether you bring bottles or you bring a list. Bring them. And you want doses, you want how often you take them, and you want what pharmacy do you use. Because your doctor needs to know, is it Walgreens in Collinsville or is it a mail order pharmacy? Because then otherwise you're going to call for a refill and that's going to get all screwed up. So always bring that. And then you want to include anything over the counter. If you're taking a bunch of ibuprofen, that's really important that your doctor knows because that can have a lot of issues to your kidneys and your stomach. Are you taking a new diet supplement over the counter? A lot of the herbal things, like any of the herbs that start with G, for example. So garlic, ginkgo, those things actually interact with Coumadin, which is a blood thinner. So there are a lot of these little nuances that people would never think, but your doctor knows. So any pill that you put in your body, write it down and take it to your doctor. For our younger folks, something that's really come out of these energy drinks. You know, like for example, teenagers now that are having tons of migraine headaches. If you really sit down and ask them, well, they're having a Monster at breakfast, they're having a Monster after school, and then they're having a Monster before track practice. It's probably why they got migraine headaches. So all that kind of stuff is really, really important. You want to write down any time you've been to the emergency room or the urgent care. You got stitches and you got a tetanus shot. Your doctor needs to know that. If you've been to the chiropractor, if you've had acupuncture, if your orthopedic surgeon sent you to physical therapy for your sore knee, your primary care doctor wants to know all of that, and they're going to keep that in your medical record. Because your primary care doctor is your home. That's where all of the base of your medical records should live. So if anything ever happens, that's the person that needs to know. So as great as it would be if everyone would communicate with each other, when you're dealing with different health systems, it just will not happen. So you have to write it down and you bring it to them. And what I said is I keep a Word document. Each time I go somewhere, I say, this has happened since we were here last. Some doctors are going to be annoyed by it, but I don't care. You know, they've got to know, and that's the only way to remember it. Yes?
I recently put my mother in a nursing home, and I have yet to see the doctor that runs the nursing home.
Yes.
And Mother's a retired nurse, so there are questions from her that I can't answer about where is he.
Mm-hmm.
The person that we do see is his nurse
Practitioner,
and she seems very nice,
Mm-hmm.
and I've liked everything, but should I just not expect to talk to him?
So with nursing homes, there usually is a medical director that has to see the nursing home patients every 60 days. So what they'll do is they'll come in and they'll see 50 patients in a day. So it is very hard to see them, but you can ask because most of the time the facility knows when that doctor's coming. They know that Dr. X comes on Tuesdays in the morning, and unfortunately you may have to camp out there from 8 a.m. until noon, but that's the best way to get them because a lot of the doctors that do nursing home work don't have an office. So you can't call their office and say, when is Dr. Smith coming to see Mom? Because there isn't anybody there. That's how most of the nursing home care around this area has done. Primarily, they're all kind of just doing nursing home work. They usually work 7 or 8 nursing homes. They're traveling in their cars, so they kind of work from their cell phones. But the best way you can go about that is talk to the staff at the nursing home, your patient's nurse or your family's nurse, or you can also talk to the DON of the facility, and they will have some idea of when that doctor comes. You can also try talking to the nurse practitioners because a lot of times they'll obviously have direct connection to that doctor, so you may at least be able to get him on the phone, he or she on the phone, where you at least do that if you can't see them in person. Yes?
Hi, this is just a tidbit of trivia, but my wife came up with this kind of what I call a cheat sheet. And basically what it is, it's dated, and that's very important because you want to make sure you have the most recent information. But she has, her name, address, phone number. Then she has her primary care doctor, their address, their fax number, their phone number. She has her gastroenterologist. She has the pharmacy that we use. She has a cardiologist. She has her pain management doctor. Again, addresses, phone numbers. She has her daily medicines, what she takes in the morning, afternoon, mid-evening, evening. She has her allergies on here, which she has significant allergies, as needed medications. She has surgeries and hospital stays that she's had. And she also lists her various medical issues and dates and everything. And she keeps us updated on a monthly basis. And she had a stroke back in December. And she had just updated this 2 days prior to the stroke. And of course, when you take your loved one and you don't know what it's, you never know when something like that's going to happen. I took this out, gave it to the doctors at Barnes, and they said, my God, I wish everybody would do this for us because when we get a patient, an emergency type situation like this, we don't know what meds they're on. And you probably don't know everything. She's on 12 different prescription meds plus all these other medications. and they thought it was the greatest thing since sliced bread. And I was just encourage everybody to come up with something like this. List all your doctors, their fax numbers that's also a very important item. List their phone numbers or addresses. List your medicines, list your surgeries, list your allergies, another very important item. And I just, like I said, she did one for me and one for her, and it's been a godsend. So
That's perfect. I applaud you for doing that. It'll also save you a ton of time. A lot of times when you go to a doctor's office to fill out your paperwork, just say, here it is. And they copy it, and it saves you writing 6 pages of stuff. Yep, there you go. Yes. Yeah. Some facilities, actually it started with a group of OBGYNs, have made these bracelets that look like Fitbits that have all that information for their OB patients. So there's a practice, actually it's Heartland Healthcare. They're all over the place. But they're women, when they go in as OB patients, they get what looks like a Fitbit, and that way if they ever have an emergency or end up in the hospital, they have a bracelet that the hospital can scan. Yeah, I wish I could tell you how either, but it is, I don't know how to get it, but it's amazing technology.
In your packet,
There we go.
you have this file of life, and the form inside lists a lot of the things the gentleman is not as complete as what he was talking about. But I keep one of these in my purse, so when I'm at the doctor, I don't have to try to remember the name of my medicine.
Yep.
So use it.
Mm-hmm. Yep. Yes.
Yeah. My father-in-law is 90 years old, and he's got congestive heart failure, so very at risk. He's also a veteran, retired farmer, and I was wondering, one of his favorite ways to pass time is to sit outside. When he was 60 or even 70, getting a sunburn or getting an insect bite or maybe getting a little poison ivy was not life-threatening. Is there a list of those things to think about?
You mean just specifically what would be dangerous for him being outside?
What's more risky for someone who's like at end of life and not in great health that we don't really often think about?
Well, I mean, your biggest thing, of course, is risk of infection. That's what we worry about towards the end of life because immune systems are compromised. So anything that causes a break in the skin certainly could cause risk for infection. Falls are the biggest risk, I would say. So making sure that your loved one is steady where they're at, that they're in an environment that they're not at risk for falls. And then, insect bites aren't such a big deal. For the most part, you usually don't have infections after those. Just making sure you're cleaning anything, making sure soap and water is your friend there. I don't know if I can give you a list per se. I mean, the biggest thing is, most of you, I'm sure, know towards the end of life what happens is people either fall because there's some horrendous statistics with hip fractures that about 75% of people after a hip fracture would die within the next year. So falls are the biggest thing you want to try and prevent for our folks, and then infection. So, keeping sick people away, trying to stay away from little kids, just minimizing interaction, like say something like this. We're out in a bunch of public people. If you've got a compromised immune system, this might be not the best circumstance, particularly if someone at your table's coughing. So just being careful of those things. I don't know if that's beautiful. Yes, that's very, very important. Thank you for mentioning that. Yeah, making sure your loved one is drinking plenty of fluids, not eating a whole bunch of salt, which will increase their risk of dehydration also. So that's very important. Yes.
If you can't get a hold of your doctor, even though
Yeah.
the doctor we had for years quit all of a sudden. He went to work for the VA. And the new doctor, when he took over, we went ahead, we had our appointment, and we told him, we need a way to get a hold of you. Oh, just call the office. And if the office is closed, we'll just call the exchange. I needed a doctor about 3 weeks ago. I started on Monday. On Friday, I finally got a call back. I called 3 times a day for 4 days.
I think you need a new doctor.
I do too. Okay.
Yeah.
Well, that's
and that's
the other thing.
Yeah.
Is they got my medicine all wrong too. When I asked them to do that.
Yeah, and unfortunately, that is not an uncommon thing I hear. Say that louder for us. Yeah, exchanges are supposed to work that way. The expectation is that a doctor should call back within 15 minutes of a page going through. That's kind of standard of care across the board. So if you have a doctor that is consistently not meeting that, then yeah, it's time. And sometimes the best doctor in the world, like your doctor probably knows, but let's give another doctor the benefit of the doubt. Like, say you've called that doctor's office every single day and no one's calling you back, your doctor may not even know, and that's the bad thing. If their front desk staff is a disaster, so you tell your doctor when you see him next. Oh. Yeah, so make sure, if it's not directly calling the exchange and not getting a response, make sure you let your doctor know if there are issues with his front office staff, because they really won't know. I didn't know. I had an employee that apparently was the next thing to Satan, and I had no idea. She was sweet to me. I thought she was great, but I kept having patients come in and say, I like you a lot, but this one's got to go. And she went. But, because we go from room to room to room to room to room, and then we have 18 inches of paperwork, and then we go from room to room to room to room to room. So we have no idea what happens in the front office. So just, like I said, yours is a different situation, but if it's happening, make sure your doctor knows that it's happening, because they won't. Any other questions? Yes. So what causes delirium, do you mean? Okay. So when we talk about delirium, so delirium is basically an altered level of consciousness. It is not the same thing as dementia, and sometimes the things can be confused. Dementia, as I'm sure most of you are aware of, is just kind of this general cognitive decline, and then there becomes a functional and a physical decline as time progresses. So that's very slow and progressive, whereas delirium has a very quick onset most of the time. So that's usually how we distinguish the two initially. Now, dementia patients can get delirious. That happens. But delirium is an acute onset of a change in level of consciousness. So in other words, this patient's pretty normal on Monday morning, but by Monday afternoon, things are not okay. So it's usually, confusion is your hallmark symptom, and sometimes it can go so far to be as agitation and combativeness. Sometimes it can be hallucinating, visual hallucinations, people picking at things. They think there's bugs in the corner of their room. So it's just this change in level. And there was an algorithm we learned in medical school where each letter of delirium stood for different causes of what did it. So D is drugs. So the first thing, and we can be talking illegal substances. So certainly in certain populations you want to worry about street drugs, but you also want to think of our typical pharmaceuticals. A lot of cold medications can cause delirium, actually, in the right population of people. Some stomach medications. So if your family member or you have been on a new medication, that's one thing you want to think about. Electrolytes. So let's say you are dehydrated, like this lady mentioned. So if you've not been eating and drinking, if you've had a stomach bug, your family member, I should say, because if you're delirious, you won't know you're delirious. So if you're with someone that's delirious, and then L is for low, so if your oxygen levels are low, so if you've got a pneumonia, if you've had a stroke and you're not getting enough oxygen to your brain, if you've had a heart attack, you're not getting enough oxygen because of that. So anything that causes your oxygen levels below can make you delirious. We can go on and on and on. But it's just, if you all of a sudden see an acute change, so things happen very quickly, that's not dementia. Okay, so if your loved one was normal one day, a few hours later they're not, there's a cause for that, and you need to get them to a healthcare provider to find out why, because it very well could be reversed. Infections, yes. So in our elderly folks, UTIs are certainly probably one of the most common things we see. Elderly folks won't necessarily get the classic symptoms of a urinary tract infection that we would get, or they just can't tell you. They may indeed have burning when they urinate, but they may not have the capacity to express those symptoms to you. So in a nursing home population specifically, when people start to have delirium, UTI is one of the first things we think of. pain can do it. That's one that in hospice we deal with a lot, and it's kind of counterintuitive. People wouldn't think that just because you're in pain, you can kind of have an altered psyche, but you truly can. Retention of urine and stool. So if you can't urinate, in particular older guys that have prostate issues, or if you've been constipated for days and days and days, it actually can make you delirious. So there's lots of things, but I don't know how much we want to learn on that today. Any other questions?
I've got a question.
Yes.
I've got a question that's completely different direction.
Sure.
At St. John's Community Care, we very often get questions from our families. Two things occur to me. One is, mom's still driving. I don't think she should. How do I handle it?
Okay.
That's a really tough one. And sometimes
is.
we say, call your doctor's office and ask the doctor if he or she will write a prescription saying no more driving.
Okay, and that is a very hard one that I got a lot in the office because it's very subjective. So you're usually the person that's driving will tell you one story. The person that's saying they shouldn't drive is telling you something very different. So then you get to be the bad guy in the office room. So actually something very, very wonderful was developed. Memorial Hospital's physical therapy department, and I don't know if St. Elizabeth's does this either, so they may very well. I'm not trying to promote one over the other. But they actually developed sort of a curriculum type of thing where they will test patients for their ability with reaction time, visual acuity, and things that you really want to focus on with driving. Sometimes it's a no-brainer, and it's very obvious to the doctor that that patient should not be driving, and then your doctor will write that down. And then it's, unfortunately up to the family then to make sure the keys aren't available anymore. But if it's one where it's sort of questionable, that's what I would do is I would refer for a physical therapy evaluation. And that way it's objective. So the patient then too felt a little more validated, that they did go through the test, and then sometimes they understand their limitations and it makes more sense to them after the fact. So that's how I would handle that. But yeah, it is straight to your doctor type of thing. It's because there's really no one else that can do anything about that besides just arguing within the family. So it's definitely a doctor question.
The other category is daughter's worried about mom's memory loss and dementia and wants to talk to the doctor without mom there. Mm-hmm. How can that be handled?
That's also a tough one. Some doctors absolutely will not do that. The reason for that is they can't bill for it, which sounds terrible, but it's the truth. If a patient is not in front of you, you cannot bill for your time. So that's where people can run into troubles. But the way it should be handled and then we've got HIPAA issues. So we have to make sure that patient, say mom's name is June, and June, when she became a patient there, filled out a list that you could talk to June's husband, Bill, and that was it. Okay? So if the daughter's name is Mary, and Mary calls and says, I'm really concerned about my mom, June, that office cannot speak to her. So that becomes an issue. So then you've got to try and talk to Bill and say, try and get my name on the list. So that's one, but let's say her name is on the list. Okay, so Mary's allowed to talk to the doctor. What you can do is, and what I used to do is if I would try and get on the phone and talk to them and make a list of what they're saying. Okay, and then I would also encourage them to come to mom's next appointment. Mom may not let that happen, but if you can, say, Mom, I just want to take you out to lunch. Let's go to your doctor's visit. Let's go to lunch. So that was the trick I would tell people. Or if you can't come to the appointment, the patient won't let you, that doctor then has some ideas to talk to your mom about and will probably run a mini mental status evaluation when they come into the office. So you always want to call the doctor's office and see if you can talk to the doctor or at least the nurse. If you can't get to the doctor, get to his or her nurse. And that nurse can take a great history for the doctor. And then that doctor at least knows, this is what I'm going into. I want to make sure I ask the right questions.
If you write your concerns and mail it, if the doctor gets distracted or interrupted or whatever, they can come back to it and look at it and see what you have to say. They can't always acknowledge to you that they read it if you're not on the list, but they've got the information, and then the next time the patient comes in, they can choose to address it if they found what you wrote to be concerning. And that has helped with some of the families I've dealt with.
That's a great idea, and I've had families do that for me also, and it was very helpful. Yes. Oh, I'm so glad you asked. Thank you. So hospice, in general, is basically palliative care for patients that have a prognosis of 6 months or less. So palliative care is treatment that's designed to control symptoms, not cure a disease process. So what we do is we take patients that are likely going to have a prognosis of 6 months or less, and who determines that is the hospice medical director and their doctor. So 2 doctors have to say that, okay? Your doctor, who is your attending physician, which gets tricky because that doesn't necessarily have to be your primary care doctor. It could be your heart doctor, it could be your cancer doctor, it could be any of your doctors, but they have to say that. And then the hospice doctor has to look at the records and get the report from the nurse and agree. So that's how it gets started. And then what we do is we treat pain, we treat nausea, vomiting, we treat bowel symptoms. One of our amazing social workers is back in the corner here. They do amazing work with treating all the psychosocial aspects that come on board with this too, and helping services for families and helping the families deal with such an emotional process. And then we also provide bereavement support for 13 months after the passing of that family member. So that's kind of a general overview. Yes.
You want to repeat what you said?
Yeah. Thank you. We find it an honor to do what we do. You know, our nurses and social workers and our hospice aides are some amazing folks. It's just amazing what they do every day. Yes. No, not really. I mean, as far as these challenges and things, it's pretty much the state of medicine in the country all over.
The question was whether or not there's a difference between Illinois and Missouri. Yeah. No, I didn't hear that. You that couldn't hear.
Any other questions? Make sure I didn't miss anything I wanted to say. Oh, I did want to say something. Because this is a question I get asked a lot, and you may think it's completely irrelevant, but I used to get, patients would get so mad at me because I would not call in antibiotics over the phone. Did you ever get mad at your doctor for that? So why do we do that? Okay, so the reason, there's multiple reasons, but one of the reasons we do that is because of antibiotic resistance. So a lot of the times, like right now, I have a cold, which is a virus. So if I put myself on an antibiotic, so don't let me cough on you if your immune system's compromised. If I put myself on an antibiotic, I would start building resistance to that antibiotic. So part of the reason is we want to see our patients to make sure they truly need that antibiotic and we're not doing them a disservice. Because if you have a virus and I put you on an antibiotic, I've just set you up to be resistant to that antibiotic when you really need it in a couple years. And then sometimes it's the only time we get to see you. So especially our 30-year-old population, which tends to be the worst, they're like, oh, I've got strep throat. Call me out amoxicillin. Well, you also haven't had your female exam. You also haven't had your tetanus vaccine. So we might want you to come in so that we can say, go get this, go get this, go get this. Take care of yourself. So we're not just trying to be a total pain in the butt and get your copay, because that's what people always used to think. I used to say, I don't even get copays. I don't know where they go. They go to somebody way above me. But I really just want to see you, make sure you need it, and I'm not making you have something bad happen. Okay, that was my soapbox. Any other questions, thoughts? No? Well, thank you, everyone. It was a joy.